Guess you remembered what time the doors open today. Open today. It's 7:30, I can get in. Actually, it's 7:40, I can get in. So actually I can go straight up to our student room and use that instead of the normal student hub. Second day of prac. Let's go. Have a tutorial on feedback, so receiving feedback, types of feedback, so yeah, that should be interesting, and I think it's given by our clinical educators. Okay, so I have gone over the session plans, had a look and made notes of things I want to discuss with my speech pathology student partner, like things I don't understand or things that we need to change possibly. And now I'm going to go back over learning goals. I think I need to set some student learning goals by third week or something, so I need to remind myself what those are, the format of those, and maybe try and draft a few. So keep going. I think we start at 8:30, so it's 7:47 now, so I have a little bit of time. No one else is here, so it's probably a good time to get some work done. Talk soon. Bye. So I'm actually conducting this rehearsal that starts in 20 minutes, so I'm a little bit late. I like to be early, but that's okay.
Thank you very much. Thank you, Thalia. Thank you,
Alright, so choir is done, my voice is tired. Rehearsal over, home time.
Even if it hurts me or I get scared, just come take this risk now. We'll be prepared. I run away. I run away. Reaching for the stars, traveling so far, like a dragonfly. The secret's there, I'm everywhere. Just you and I run away.
So I'm finally home, so I thought I would tell you a little bit about my day. So we did start with a tutorial run by our clinical educators, just going over feedback, so different types of feedback, who we might receive it from, and how we should respond. So really highlighting that, ignoring it or becoming, defensive about it isn't a great way to approach receiving feedback. So maybe explaining your reasoning and trying to understand the person who's giving you feedback, try to understand their point of view and their reasoning, and then, if it's positive feedback, remain the same, or if it's something that needs to change. So it's being open and receptive to the feedback and knowing how to, maturely handle feedback. So after that, we had some more planning time for our clinics coming up. We prepared more for our skills development program, which is going to be with preps. So it's actually running basically the same lessons that I ran in first semester this year. So this year we're just taking on more of a leadership role. So that should be good. That's starting next week, so I'm excited to start that. I realize I'm saying excited a lot. Really, it's probably nervous, just ready to, jump right in and get used to it. I'm excited for this just to become the norm, so it's not as stressful. Though I'm sure the stress won't ever stop. It'll always be a little bit stressful each time, but get easier and I'll be able to adapt and, deal with new challenges quicker and faster each time. So after that, we had some more planning time. I actually was able to observe some of my clinical educators performing a session with a client, doing an assessment, doing a speech assessment. So the speech pathology clinic manager performed that, but also one of my OT clinical educators was in the room supporting as well and doing a little bit of assessment. So what was really great to see in that session was my OT clinical educator spotting his slipping and sliding just a little bit in the chair and kind of identifying to the speech path, I think we should move to the floor where there was a different type of seating, and his engagement and his ability to attend to the task just improved so quickly. Just that small change, you could definitely see a positive effect of it. It's really cool to see how with such experience and knowledge that you can spot little body posture and sensory seeking aspects in clients straight away, and just small changes like changing the seat you're sitting on can make such a big difference. I think that's really exciting. Really cool to see. And then this afternoon we practiced some different assessments that we'll be doing on Thursday. So the movement ABC can be used to help a diagnosis of DCD, dyspraxia. So it looks at motor and coordination. So we practiced performing that, and also planning for our clinics next week. That is the one I'm working with a speech pathology student. So planning our sessions for that. So that should be good, and maybe when it comes closer I can discuss some of the ideas we're using. So yeah, now I'm going to relax for the rest of the night. It's 8:25, so I think I'm actually heading to bed soon. But yeah, I'll see y'all later. Bye. Jeez. Bye.